Glycogen storage disorders and the overview. So firstly, there is the presence of glucose. Glucose is converted to glucose 6 phosphate. Glucose 6 phosphate is converted to glucose 1 phosphate. Now this glucose 1 phosphate is going to the UDP glucose. UDP glucose is going to amylopectin. Now looking at the enzymes we came across and the diseases. In terms of the glucose to glucose 6 phosphate, there is the von Gerkel's disease. Okay, von Gerkel's disease is present. And the conversion to the glucose 1 phosphate to the UDP glucose, there is the UDP glucose pyrophosphate. There's the enzyme UDP glucose to the amylopectin. There's glucose glycogen synthase which is used. Now moving ahead, the amylopectin is converted to the glycogen. So the enzyme here is the branching enzyme, and the glycogen is again converted to the glucose. This is separate, and here it is by the process here is lysosomal dehydration, and the defect in the process of the glycogen to the glucose, here it is the Pompey's disease. Now after the glycogen is present, the glycogen is again converted to the limit dextrin. Then limit dextrin is again going to the glucose 1 phosphate. So the conversion of glycogen to the limit dextran, it is the glycogen pyrophosphate is the enzyme, and the defect here is nothing but the McArdle disease. And now limit dextran to the glucose 1 phosphate. So the enzyme here is the debranching enzyme, and the disease is known as Cory's disease. This is the disease here.